Hello and welcome to the webinar for Irritable Bowel Syndrome and how to support clients in clinic. My name is Linda Vezzoli and I'm presenting on behalf of the Really Healthy Company. This is a CPD point accredited webinar, so you are able, if you've watched it, you're able to apply for a CPD point just by contacting us at the end, and I will give you some contact information. First of all, I just wanted to introduce myself. My name is Linda Vezzoli. I'm a nutritional consultant for the Really Healthy Company, but I'm a nutritional therapist as well. So I work for the Really Healthy Company on a part-time basis, supporting their customers on the phone, working on their brand management and the social media and marketing due to my previous life before becoming a nutritional therapist. And I also do a lot of education on behalf of the Really Healthy Company, both to practitioners and to consumers, presenting at events like the Allergy and Free From show, for example, but also, also to medical, like hospitals, and doing product presentations. I'm a nutritional therapist. I specialize in women's health. I work in London and remotely for customers who are not, clients who are not based in London. And I specialize in women's health, as I said, and I also have started lecturing at the College of Naturopathic Medicine, lecturing to nutritional students there. I've been practicing things since 2016. So a little bit about the Really Healthy Company, if you don't know them. They are a London-based natural health company specializing in the introduction of leading-edge and research-based nutritional supplements in the UK and Europe. They've been founded in 1995 through their passion for natural health solutions. They were the first company to introduce the Klamath blue-green algae in the UK and the European markets. And they have a small but very elite product range. A lot of it is practitioner focused. So it's great to set up a practitioner account with them because a lot of the products, especially like the Premier Research Lab products coming from the US, are a practitioner only range. They manufacture their own products such as the Klamath blue-green algae, the Alpha range, including Alpha Curcumin and Alpha Prost and Alpha Guard, Micromax, a liquid probiotic, which I'll be talking about later on, and Be Better Organic Royal Jelly. They're also distributors of other products for companies outside of the UK, like the MedPro products from Holland, which include products for the FIFA protocol for breast and prostate cancer. The Daiwa pharmaceutical products from Japan, including BioBran, NKCP, and Pronox. And then the Premier Research Lab range from the USA, as I was mentioning earlier. So what we're going to talk about today is irritable bowel syndrome. We're going to look at an overview of what it is, the prevalence and the pathogenesis. We're going to look at the presenting symptoms that your clients might be coming in for, looking at how we can diagnose it and exclude other conditions, any causes and triggers that might be aggravating them, and then looking at protocols for the two different types of IBS, IBS-C, constipation, and IBS-D, diarrhea prevalent IBS. And then I'll just look at a case study from one of my clients and what I did, just to give you an idea of things that you can do with your clients in practice. So irritable bowel syndrome is a chronic, relapsing, and often lifelong disorder. It's characterized by the presence of abdominal pain and discomfort, which may be associated with defecation and or accompanied by a change in bowel habit. It's quite an umbrella term used to cover an array of digestive symptoms, and that's why it can be a little bit hard to diagnose and to treat, because it does encompass so many different symptoms, and we have to really look at the symptom picture to see how we can actually, help our clients. It's the most common functional gastrointestinal disorder with worldwide prevalence rates ranging generally in the area of 10 to 15%. Functional disorders are conditions where there's an absence of structural or biochemical abnormalities on common diagnostics tests, which could explain the symptoms. So it's not an actual structural abnormalities that can cause it, but it can be lots of different symptoms. There's, among the patients, about 40% of the people have mild IBS, 35% moderate IBS, and 25% have severe IBS. Many patients don't even recognize IBS symptoms, yet it's one of the most common disorders seen by physicians, not just practitioners like us, but GPs as well. There's a prevalence of female versus male by 60 to 40%. And here's the prevalence. So the prevalence estimates for the IBS vary greatly internationally, both within and between countries, as you can see in this chart. In the UK, it's about 17% overall. And as you can see, it's mostly, around the North America, South, a little bit of South America, and quite prevalent in the UK as well, as opposed to other countries like Africa. So the prevalence, as I mentioned earlier, is greater in women, and it usually occurs between the ages of 15 and 65. So it's quite a large range. And the first presentation to the physician is normally around between 30 and 50 years of age. So again, quite a broad range. And interestingly enough, the prevalence in children is similar to adults, with about 6 to 14% in children and 22% predominantly in IBS-C, so constipation, found in adolescents. And sometimes if you think about it, if you think about the kind of diet that most teenagers have, I think it's not really surprising that they would be presenting with more constipation dominant IBS. So there's lots of different factors in the pathogenesis and of this condition. So we'll go through a few of these. The main one is, so one of them, it could be heritability and genetics. So it has been known that IBS can aggregate in families and affect multiple generations. And relatives of someone with IBS are actually 3 times more likely to develop IBS themselves. Another risk factor could be psychological distress, which is not only a trigger, but could also be a factor in the pathogenesis. So for example, things like parental modeling and reinforcement of the illness behavior can contribute to IBS. It could be a contribution of social learning, or even childhood events such as nasogastric tube replacement, poor nutrition, abuse, or other stresses have been also associated with IBS. Patients sometimes report onset of their symptoms after acute gastroenteritis, so a GI infection, and post-infectious IBS after viral, bacterial, protozoa, and nematode infections can be one of the triggers that starts this cycle for a client. Another thing that could contribute to the pathogenesis of this condition is the gut-brain axis. So as we may know, the brain and the gut develop from the same part of the human embryo, so they share many nerve endings and chemical transmitters. The GI tract actually contains many neurotransmitters, and 95% of serotonin receptors are in our GI tract. And serotonin is responsible for peristalsis, so the movement of the feces through our, or the food through our GI tract. It's also responsible for secretion and sensation. And sometimes IBS symptoms can be worsened by defects in serotonin signaling. So the gut-brain axis, that could also explain why someone that is under a lot of stress may be experiencing IBS symptoms. Other things that can contribute to the pathogenesis of this condition could be microflora imbalances, and that can be also because they can influence serotonin manufacture in the GI tract, and it also affects the availability of tryptophan and cofactors. Female gender seems to be one of the risk factors, as women appear to have more frequent and severe IBS symptoms during menstrual cycles than at any other times of the cycle. So female gender is an actual risk factor for IBS. Low-grade inflammation as well, and one of the emerging evidence as well also suggests that intestinal permeability is impaired in patients with IBS, landing possible credence at the concept of leaky gut. So some people with IBS demonstrate markers of increased immune activation, including higher mast cell concentrations and activations, altered immune markers, and elevated levels of cytokine, including tumor necrosis factor. So leaky gut syndrome may be an aggravating condition which worsens IBS by activating immune responses and inflammation in reaction to macromolecules which enter the bloodstream through the permeable walls of the intestines. And I thought I'd just go through some of the similarities and some of the differences between leaky gut syndrome and IBS, because they do share some similarities, but they do also have a lot of differences. So both of them impact the GI tract integrity, and they both can be triggered by diet, especially a low fiber diet, high fat inflammatory foods like trans fats, or alcohol consumptions. Both may manifest as food sensitivities, and a lot of IBS clients do have a lot of food sensitivities where they experience extreme symptoms after eating certain foods. They both have similar symptoms as well, with like digestive issues, and the microbiome plays a key role because of the main issue is around the GI tract. But both of them may improve with the use of prebiotics and probiotics. However, IBS is a functional disorder which has an established diagnostic criteria, which is the Roman diagnostic criteria 3. And leaky gut is a phenomenon that's associated with multiple disorders and diseases, including irritable bowel, autoimmune condition, chronic fatigue syndrome, eczema, psoriasis, and chronic pain. So IBS has typical signs and symptoms that we can that we will go through later on, whereas leaky gut syndrome can be they don't have typical signs and symptoms that are very immediate. A lot of the times their symptoms can be actually delayed. And there is a better established treatment options for IBS symptoms like the low FODMAP diet. But to be honest, now there's also with leaky gut syndrome, we can use, especially as functional practitioners, can use our own, our 5R protocol to work on leaky gut as well. Some of the symptoms of leaky gut can be things like migraines, changes in memory, cognition, autoimmune conditions, and chemical sensitivities, which is not something that is typical IBS symptoms as well. So let's look at the common symptoms of IBS. Normally, the main ones are abdominal pain, aches, and cramps. There will be changes in their bowel movement, including constipation and diarrhea, and often they can oscillate between the two. A lot of patients can find that they have a lot of stomach bloating, gas, and burping. Sometimes their evacuations might not be complete, or they might see mucus in their stools, which can indicate inflammation. They might feel easily full or actually not have much appetite, or even go as far as having nausea and heartburn or acid reflux as well. And then there can be some other extraintestinal symptoms, so not ones that are associated with digestion, but things like fatigue and joint pain. They can be accompanied by anxiety and depression, which makes sense when you think about the gut-brain axis, or even reduced libido. And many patients actually believe that their IBS symptoms are due to a food sensitivity. And symptoms can sometimes overlap with other gastrointestinal disorders, such as non-ulcer dyspepsia or celiac disease. So people with IBS obviously will often present to their primary care physician with a wide range of symptoms, some of which they may be reluctant to disclose as well without sensitive questioning. So as a naturopathic practitioners, we, with our very detailed case-taking process, we might be able to get more information out of the practitioners than maybe a GP would, for example. Now, some symptoms may actually be a sign of something a little bit more sinister. So it would be, these are the ones to keep in mind if your client does present with these symptoms. They are red flags. So if they're presenting with blood in stool or rectal bleeding, if they have a family history of colon cancer, inflammatory bowel disease, or celiac disease, if they present with fever or weight loss that has occurred without them changing their diet, chronic diarrhea or severe chronic constipation, if the symptoms are waking the patient up in the night, or if their onset is after 50 years of age, if they have dysphagia, unexplained or recurring vomiting, if they experience iron deficiency anemia, or if they've just come back from an exotic trip, which could mean that there's a risk of parasitic disease, or if there's a persistent pain that is not relieved by passing gas or a bowel movement, because a lot of the symptoms of IBS do alleviate somewhat once the patient has been to the toilet. So these are all red flag symptoms, and they should be referred back to a physician. I thought this is quite an interesting slide because it shows the diagnostic cascade where, as a physician, how they would go and make an IBS diagnosis. So again, the blue box shows the diagnostic criteria, from the Roman 3 diagnostic criteria, whereas recurrent abdominal pain or discomfort for over 3 days per month during the previous 3 months, with 2 or more of these symptoms: a relief when they do defecate, a change in stool frequency and form, bloating and or digestion. If they don't have any of the alarm features that we mentioned before, then they will look at laboratory testing, like full blood count, inflammation markers, any thyroid function, which could impact also the rate of defecation. If there's any occult blood or stool samples, or checking for celiac disease. If they are normal, then they would have the IBS diagnosis, and then they will look at trying to really alleviate their symptoms. If the tests come out abnormal, then they would investigate further. Some of the things that need to be ruled out when they're diagnosing for IBS is some like inflammatory bowel disease and celiac disease, which will be you can see in the diagnostic cascade before will have been tested. If there's a lactose intolerance, if the client has been abusing laxatives, that could actually be contributing to their symptoms. Diverculitis, any pelvic inflammatory disease or endometriosis, which would cause issues in like pain, abdominal pain, and issues with defecation. SIBO, small intestinal bacterial overgrowth. If there is colorectal tumors or an infectious enteritis or any sort of bacterial infection. If there's any mechanical causes by a fecal impaction, or an excess in the candida yeast. So what would the medical treatment be? There's a few things that are recommended by the GP if they go to a physician with these symptoms. And one of them that would be antidepressants, especially SSRIs. So the way that antidepressants are used is they can block the brain's perception of pain in the gut, but also because of the crucial role of serotonin in the physiology of the gastrointestinal tract, they can now show that serotonin reuptake inhibition can have profound effects on the control of the gastrointestinal sensory motor function. So that's one of the things that might be just might be prescribed. For IBS-C, the doctor may also, they might prescribe small doses of these SSRIs. So things like citalopram, Lexapro, fluoxetine, which is Prozac, and sertraline, which is Zoloft. But they can also include side effects, which include a nausea, loss of appetite, and diarrhea, which in a way might make their symptoms worse. Other things that can be included are things like antispasmodic drugs, such as dicyclomine and hyoscyamine. They can relieve the stomach cramps brought on by IBS by relaxing the smooth muscle in the gut. But they may also cause constipation, so they aren't really usually prescribed for people who suffer from IBS-C. And other side effects of these medications can include dry mouth, drowsiness, and blurred vision. So some of the antispasmodics that we might be able to include, and some of them that's often also prescribed or suggested from the GP, are peppermint oil, which use that sort of same relief in the stomach cramps. And the other thing that might be recommended, especially with people that have C, are laxatives, and they can be osmotic laxatives. And what osmotic laxatives do is they pull water back into your colon, which softens your stool, so it's easier to get it out of the body. So they're fairly safe to take for long-lasting constipation, but you just have to make sure that you drink plenty of water when you take them to avoid getting dehydrated. However, osmotic laxatives can also sometimes cause problems for some people, like bloating, diarrhea, and dehydration. And in rare cases, some of these may lead to kidney or heart disease. Osmotic laxatives include milk of magnesium, magnesium citrate, sorbitol, polyethylene glycol, and lactulose. And a lot of these brands can be bought over the counter at the pharmacies. Stimulant laxatives are usually ones that contain a chemical called senna, and that triggers the muscles around your intestines to squeeze and move the stool through your colon. And while they do relieve constipation, they shouldn't be really be taken on a regular basis, because when they're taken for a long time, the body can get used to them, so they don't work anymore. So you can also get dependent on them, so you will need them to stay regularly. So some of the things that examples of stimulant laxatives can be Dulcolax or Senocot. And the side effects of these can include diarrhea, upset stomach, vomiting, and stomach cramping. One of the things that's also quite often recommended by physicians if someone presents with IBS is a low FODMAP diet. And what FODMAP means is fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So avoidance of the food containing these fermentable carbohydrates could help IBS patients who are still experiencing gut symptoms despite trying to change their diet and lifestyle, for example, with stress management, removing trigger foods such as dairy, coffee, alcohol, and spicy food. So some of the things that would be recommended to reduce in a low FODMAP diet would be certain fruits, for example. So fruits contain the sugar fructose, and that can cause issues for IBS sufferers. Fructose is normally particularly high in foods like apples and pears, stone fruits, dried fruit, fruit juices, and watermelon, for example. So some of the fruits that you would recommend to eat instead are fruits that are lower in fructose, such as bananas, blueberries, cantaloupe, melon, cranberries, grape, oranges, lemon, limes, kiwis, and strawberries. Vegetables as well might also cause gas and abnormal bowel habits. So for example, cruciferous vegetables such as broccoli, cauliflower, cabbage, coleslaw, and sauerkraut, or things like artichokes, which contain a lot of, or asparagus, shallots, onions, and leeks, they can cause a lot of bloating and gas. So things that you could eat if you are on a low FODMAP diet are things like eggplant, green beans, celery, carrots, spinach, sweet potatoes, courgettes, and squash. And then a lot of other herbs as well. So legumes and beans are also not really recommended on the low FODMAP diet because they contain undigestible saccharides. So their IBS patients are normally asked to avoid them and or eat them in very small quantity. And other things that they might be asked to avoid are things like fizzy drinks, lactose-containing foods, and sweeteners such as sugar alcohols, which are often now included in more sort of low sugar foods and drinks. They can actually cause problems. So things like sorbitol, mannitol, isomalt, maltolol, and xylitol. So you can actually eat old-fashioned sugars on a low-fat FODMAP diet, even artificial sweeteners that don't end in ol, that aren't sugar alcohol. But obviously, as naturopathic nutritionists, this is not something that we would recommend. Or things like honey substitutes, maple syrup, molasses, and golden syrup are also okay on a low FODMAP diet. So some general guidelines for people that have IBS is making sure that they drink plenty of fluid each day to ensure that they have a good, that they are hydrated, and that can help with bowel motility. Sometimes you might look at considering the removal of gluten and dairy from the diet, as these can cause more symptoms and aggravation with people with IBS, or getting clients to keep a food diary as well if they haven't identified any food triggers. So what they've eaten, when they've eaten it, and any symptoms, and also maybe look at their stress levels as well during that time, what's happening around the time that they're eating those foods. Avoiding caffeinated, fizzy, and alcoholic beverages, and also limiting fruits to 3 portions a day, and avoiding fruit juices, as we mentioned before. So there's different types of fiber that can affect different IBS sufferers differently. So insoluble fiber like bran should be avoided if your client is experiencing gas, bloating, and diarrhea. But if they are experiencing constipation, then they need to add more fiber, such as low sugar fruits, vegetables, and beans and whole grains. Now we're going to look at the 2 different types of IBS. IBS that's C, so constipation predominant IBS, and then IBS-D. So some of IBS-C is constipation is defined if your client has less than 3 bowel movements a week, if their stools are lumpy or hard, or if they strain when they're passing bowel movements. So some of the risk factors for this could be if they're not eating enough fiber, or if they're dehydrated. That would make it harder for the food to digest and go through the intestines. If they have any endocrine issues, for example, hypothyroidism, that can really slow down digestion. So that's something to investigate. If they are very sedentary and they're not moving around a lot, if they've got any gut dysbiosis, so if they've been taking a lot of antibiotics, for example, if they experience anxiety or low gut serotonin, that could cause constipation as well, because as we saw earlier, serotonin is crucial for the peristalsis. If they're on certain medications like iron supplements, constipation can be one of the side effects, and acid, opiates, and codeine. Now with methane-dominant SIBO, how it works is that single-celled organisms called archaea, they are responsible for the methane form of SIBO. So when you eat fiber, the bacteria in your gut ferment it and they produce hydrogen, and the archaea feed off of this hydrogen. So it's only once the archaea that consume the hydrogen that they produce their own byproduct, which is methane. So that can slow down the transit time, which can lead to constipation. And pregnancy as well could be one of the risk factors for IBS-C, because the hormonal changes during pregnancy can affect bowel function and can lead to even more constipation. So what are the things that we can do if someone presents with constipation predominant IBS? We could increase their fiber intake by adding fruits and vegetables and low glycemic fruits, especially like berries. Making sure that they have enough fluid intake and hydration whilst avoiding caffeine and fizzy drinks. Eating meals at regular times to train the digestive system so that they know when food is coming in and when this is going to be digested. And one of the things that's really important and that a lot of my clients don't do, especially our female clients, is making time for daily bowel movements. So I don't know if anyone that lives with a man might realize that the men always take their time in the morning, sitting on the toilet, pondering the world, whilst a lot of the women tend to kind of be rushing around and not really making the time. So what I normally recommend to my clients who have constipation issues is to just sit on the toilet at the same time every day for about 10 minutes or so. And even if nothing happens, just to train the body that this is the time that you're going to the toilet. I mean, it doesn't have to be in the morning. It can be at any sort of more convenient time, but especially trying to make it the same time every day. And in time, that can train the body to be prepared for the bowel movement at that specific time of the day. Increasing exercise can really help with stimulating movement and blood flow to the intestinal tract and encouraging bowel movements, and including other foods for example, flax seeds, psyllium seeds, chia seeds, and those are really great to help with bulking up the stool and getting things moving. Flax seeds, I normally recommend having some ground flax seeds and putting them in a little bit of water, letting them gel, and then drinking them and chasing in with a big glass of water. And you can do that with psyllium seeds and chia seeds as well. And you'll notice that they create a sort of gelatinous coating, which can really help also soothe the intestinal tract as it's going through. Things like prunes, apricots, papaya, and glucomannan fiber can also really stimulate bowel movements. Adding bitter foods or a herbal bitter to the diet can really increase the stomach acid production and bile, which can encourage healthier bowel movements. So things like rocket, artichokes, dandelion greens, beet greens, those are bitter foods that you can include in the diet, or just a herbal bitter supplement as well. That can include dandelion root or even more really bitter herbs like gentian. I like to add probiotics as well to improve intestinal motility, and magnesium-rich foods or a magnesium supplement which might have a laxative effect, like magnesium citrate. So magnesium-rich foods are normally green leafy vegetables. Some dark chocolate also contains magnesium as well. And you may consider testing for methane-dominant SIBO, because we looked at earlier that can be one of the risk factors for IBS-C if they are not experiencing any relief in their symptoms with these changes. Now, IBS-D is a more diarrhea-predominant IBS. And some of the risk factors can include the abnormal movements of the colon or the small intestines, or if there is a viral or bacterial infection in the stomach. SIBO could also be a risk factor for this condition, but this time a hydrogen dominant SIBO. And we saw earlier that that's more, due to eating less fiber. Hormonal imbalances, for example, Graves' disease, can make someone more predisposed to diarrhea predominant because it speeds things up. And then with the neurotransmitter imbalance as well, as we saw earlier, with the serotonin's role in the GI function. So serotonin increases intestinal motility. So higher serotonin production would increase the secretions as well. So working in the opposite way as IBS-C. Anxiety and stress can also cause this due to the gut-brain axis. So what sort of things could we do for IBS-D? We could look at the 5R approach, which I will look in a little while. We're also looking at identifying any food intolerances and looking at implementing an elimination diet. We can bulk up the stool by adding soluble fiber, such as apple pectin, acacia fiber, and glucomannan. And that can bulk it up and make it less, make it more formed and help with the diarrhea aspect of it. Digestive enzymes can be used to reduce inflammation and to help digestion. And also there is a specific probiotic yeast that has been shown to be really helpful for diarrhea, and that is a Saccharomyces boulardii. And you can buy that in many formulations at the moment, in health food stores. Slippery elm powder is also a fantastic item to add into a client's diet, because it is it's a demulcent herb, and it's very healing to the gut. So they can either add slippery elm bark powder to their porridges, make a little gruel from it, or even make little slippery elm lozenges by mixing the powder with some honey and putting it in their cheek and letting that dissolve. If they are experiencing bouts of diarrhea throughout the day, then they might be prone to dehydration. So it's very important to replenish any lost fluids and electrolytes by drinking enough water, but also adding the electrolytes in by adding some very high quality sea salt or an electrolyte supplement. Enteric coated peppermint oil, we talked about it earlier. It's a great antispasmodic, so it can really help with the spasms of the gut. So that's something that, again, is very easily found even in high street shops. So that can be something that can be very helpful. Making sure that it's enteric coated though, and then avoiding any artificial sweeteners like sorbitol and those sugar alcohols. And BioBran, which I'll speak to about in a little while, talking about that's been shown actually in studies to help with predominant IBS, predominant IBS, yes. So the 5R protocol is something that we are very familiar with as practitioners. It was developed by the Institute of Functional Medicine, and it's an approach used for healing digestive issues. So this can be used both for the IBS, but also for leaky gut. And it's the 5 phases, removing any specific things that are causing any specific triggers, replacing it, re-inoculating the gut, repairing the gut, and then rebalancing. So what we would look at removing is looking at any food sensitivities, or if there's a bacterial overgrowth or SIBO, if there's yeast overgrowth or parasites, and we can do that with things like elimination diet or a FODMAP diet. If there is bacterial overgrowth or SIBO, then we can look at a low FODMAP diet, or even refer them to GP for a rifaximin, which is an antibiotic that's been found to help with SIBO. The great thing about rifaximin, as opposed to a lot of antibiotics that will just wipe out your whole gut bacteria, is that rifaximin has actually been shown to just work on the small intestinal bacterial overgrowth. So it won't actually really wipe out your whole gut flora. Other things that we can use that are more natural are things like berberine or allicin, which comes from garlic, or oil of oregano. And for parasites, MedPro do a really fantastic a really fantastic product called armisinine that's been shown to be really great for any parasitic overgrowths. Now, if we want to replace what's missing in the digestion in terms of maybe stomach acid, or if there's not enough digestive enzymes to really break down the food, and some of the products that the Really Healthy Company offer are things like the Premier Research Lab range, which contains Digest and Digestase, or the Premier Research Lab HCl and HCl Activator. We will then want to re-inoculate the gut, putting back in the gut-friendly bacteria that is needed. And Micromax, which we'll talk about a bit later, is a fantastic product to do this. And we'll want to repair any issues that have been caused by either inflammation or leaky gut. And we can do that with products such as BioBran, which I'll talk about a bit later, or by adding any anti-inflammatory products, supplements, like EPA and DHA, or a fantastic anti-inflammatory product like alpha curcumin, which is high absorbable curcumin extract. If they are experiencing leaky gut, then using products that can really help with healing the lining of the gut, like glutamine or slippery elm, which I talked about earlier, DGL licorice, or even intermittent fasting has been shown to really help with the repair of the gut lining. And then what we want to do is look at rebalancing. So really focusing on stress management and adequate sleep, which is something that I really find, and I'm really hard to implement with my clients because they might be able to implement a lot of dietary changes, but stress management and sleep is something that's really hard for them to come to terms with, especially in London or nowadays in our Western society where we'll just go, go, go all the time. So some of the things that we could do is use cognitive behavioral therapy and meditation, mindfulness, yoga, and breathing. And when we're helping our clients to improve their sleep, making sure that they're aware of proper sleep hygiene in their homes, like about not watching screens late at night, sleeping in a cool room, making sure it's dark. And also some supplementation like magnesium can really help with that. Other final suggestions for IBS support would be to work on their behavior, which we looked at earlier. So reducing avoidance behavior. So what avoidance behavior is that they're actions that are taken by a person to escape from their difficult situations, thoughts, or feelings. So for example, a child that doesn't want to go to school because they're experiencing some issues there, or if there are people that isolate themselves or might go and be in denial. Cognitive behavioral therapy, what we mentioned it earlier, in stress relief and management, that can be really helpful, and including relaxation and stress management techniques into their daily lives. Hypnosis could also help, especially with it if it's a gut-brain issue. And fasting therapy, and there's only really one study that showed how fasting can help with IBS. They had about 58 patients with moderate to severe IBS, and 36 patients went on a 10-day water fast, plus a little bit of intravenous nutrition, and the other 22 patients were giving basic treatment, which was medications and brief psychotherapy. And the fasting group had significant improvements with 7 out of 8 IBS symptoms, including abdominal pain, distension, diarrhea, decreased appetite, nausea, anxiety, and the quality of life improvement. Whereas the other group who consumed a regular diet, not a FODMAP diet, plus the basic treatment, only really had improvement in 3 of these 8 symptoms. So after the water fast, the patients were slowly fed 300 to 2,100 calories a day to prevent the refeeding syndrome. This was a very long fast, over 7 days. So it's at risk of having, overfeeding syndrome if that's the case. So it's quite an extreme experiment that was done. And there's only really one study. So there are more studies that are needed with regards to fasting. But one of the ways that intermittent fasting could help, which is not quite as extreme, so it's only reducing your window of eating, is that if you're not eating often, you may not be consuming as many FODMAPs. So that can give your gut a little bit of a rest with digestion. Fasting also allows the migrating motor complex to be more efficient, and it may improve autophagy if you're fasting for more than 20 hours a day. It could also improve weight loss, and it may improve the microbiome, but more studies are really needed to show how fasting can help with IBS. But it's something that you might want to consider for your clients, or suggest a sort of shorter intermittent fasting. So here are some of the products that the Really Healthy Company have to offer with regards to helping your clients with IBS symptoms. And I'll go through some of them, specifically Micromax and BioBran. But you can see the PRL, the Premier Research Lab range, which is fantastic. They don't have any excipients. A lot of their products are fermented. They're very high quality. They're all vegetarian products as well. And then there's the alpha curcumin, which is a super bioavailable curcumin complex that contains long Vida curcumin. And that has been shown to cross the blood-brain barrier as well. So it's a really potent anti-inflammatory, as well as the MedPro artemisinin, which is fantastic for parasites. So I'll go into a little bit more detail now about the Micromax and the BioBran. So the Micromax is a liquid probiotic, and it's based on the works of Professor Heger and Rudolf Steiner. It's made in Austrian Alps, used through biodynamic farming. And how it's made, it's fermented. It's 40 different alpine herbs that are fermented with organic molasses and aerobic and anaerobic microbes. So the molasses is all used up in the fermentation process. So there's no sugar in the final product, and it's very safe for diabetics. And the final product contains up to 80 species of viable, so non-freeze dried, because it is in a liquid, bacteria. So it's very, there's a very massive range of species, as opposed to a lot of other probiotic supplements which contain many billions of just one and two. This one seems to be more like what's, similar to what is in our gut microflora environment. I see it as more of like a very like a food-based supplement, really, because it is liquid as well. And because it's a liquid, it's more easily absorbed. So if you take it on an empty stomach in the morning, it will bypass stomach acids through a duct in the stomach and will go straight into the intestines to inoculate it. It's a vegan product, it's non-GMO, it's gluten and lactose free. And one bottle of a liter will last about 6 weeks, but we also now sell it in half-liter bottles as well. Now, last year, there was a study done on Micromax in 2019 to look at to try to determine the efficacy of the product on the gut microbiome. The participants that were in the study were asked to consume Micromax twice a day, morning and evening, for 12 weeks. They were not asked to make any other dietary changes, so they weren't on a low FODMAP diet. And actually, the criteria for enrolling these participants was that they had to have quite severe digestive issues, as well as other issues as well. Some of them had diabetes, some of them were overweight. They were people that didn't have the best of diets, so smokers, drinkers, or people that ate fried or processed foods. So they took these, they had a stool sample taken before they started the study, and then again at the end of the 12 weeks after taking Micromax for that time. So one of the things that we saw across all of the participants is that they all had a decrease in Clostridium bacterial count, and the Clostridium can populate the gut after antibiotics use and can cause symptoms such as diarrhea, nausea, stomach pain, or loss of appetite. So all of them had a decrease in this Clostridium. Also, all of them had an increase in pancreatic elastase, and that's an enzyme which can be measured in the stool, and it's a marker for digestive function. So normally low elastase would indicate pancreatic insufficiency, and therefore that the intestine cannot absorb nutrients. So having increase in pancreatic elastase also showed an increase in digestive function. All of them also had a reduction in alpha-1 antitrypsin, and that's a marker for IBS and inflammation of the gut. So it looked like taking Micromax, despite still carrying on with their inflammatory diets, they still had a lower marker for IBS and gut inflammation. And the dysbiosis index was improved in all of the participants, as well as just looking at their stool samples. They also monitored their symptoms, and all of the participants experienced an improved digestive symptoms, including bloating, acid reflux, and distended stomach. Next up is BioBran, which is a Japanese product made by Daiwa Pharmaceutical. It's made from the rice bran that's broken down from an enzyme derived from the shiitake mushroom. And what's left over is a compound called MGN3 arabinoxylin compound, and it's been clinically proven to enhance depleted immune systems. So normally starch, dietary fiber, they're classified as polysaccharides, and the starch is digested in the saliva, pancreatic juice, and intestinal juice, and absorbed in the small intestine. So normally dietary fiber is not digested and is excreted unchanged. But what BioBran done, because it has such a low molecular weight, the MGN compound, it's known to be partially absorbed directly in the digestive tract and entering the blood system. bloodstream. When it enters the bloodstream, it actually activates natural killer cells, T cells, B cells, and macrophages, either directly in the blood or indirectly via the Peyer's patches of the ileum. So it's a really potent immunomodulator. It works with, it helps to stimulate the immune system if it's low, or also works as an anti-inflammatory, anti-allergy, and antioxidation process. A lot of the times, so this product has been around for many years, about 25 years, and it's also been the subject of many human trials and publications. There's over 50 peer-reviewed studies at the moment showing its effect in immunomodulation. Most of them are done on cancer, in vitro and in vivo trials, but there are also other studies that show its powerful anti-inflammatory effects, for example, with rheumatoid arthritis, where it's been shown to decrease the rheumatoid factor. And there's other studies as well with regards to just quality of life, as on geriatric patients, but also on IBS. So here is a study that was done on IBS, especially diarrhea predominant IBS, where they had 34 patients with IBS. The MGN group had 1 gram of BioBran twice a day for 4 weeks. And then there were the placebo group that they did not have anything. So they checked, they monitored the changes in the symptoms, and they looked at things like stool frequency, stool consistency, feeling of incomplete evacuations, and abdominal distension. So a lot of the stool frequency and the feeling of incomplete evacuation tended to improve at 2 to 3 weeks after the start of the treatment, whereas in the placebo group, there was no significant changes. So the conclusion was that they were looking at trying to examine the anti-inflammatory and immunomodulatory effects in IBS patients, and they did notice a significant improvement in patients who took BioBran treatment compared to those of placebo. So this can be something that can be put into a protocol with a client who has diarrhea predominant IBS. And there was another study as well done on on mice. This one was specifically looking at their intestinal barrier dysfunction after radiation, but it was quite interesting. So they gave these mice MGN3, so the BioBran prior to the radiation and 4 weeks after, and they noticed that the MGN3 reduced the oxidative stress levels and inflammation response indicators, both in the serum and the jejunal and colonic mucosa. They also noticed an increase in antioxidant indicators, such as superoxide dismutase, glutathione, and catalase. So it looked at the changes in the intestinal mitochondrial function and intestinal permeability and barrier function as well. And it seemed to really protect them after radiation. So this could be a great indication for, a great start to look at for using it in people that have leaky gut or compromised intestinal barrier function. So BioBran comes in different formats. It comes as 30 sachets or 105 sachets. It comes also as in tablet form, depending on what the dosage that you want to give your clients. Now, finally, before we finish, I just wanted to present a brief case study of a client that came to me last year with a severe IBS. So she was worried about her weight gain, and she had very severe IBS symptoms that had been going on for quite a long time. Constant bloating and abdominal distension. She had flatulence, heartburn, indigestion, and constipation. Where she would go maybe once a week. She was experiencing a lot of stress in her personal life. She was planning her wedding, and she also did a lot of high intensity exercise with 1 hour sessions 4 times a week. On top of that, she was also experiencing very heavy periods, large clots, and was also been told she had ovulation issues and might be looking at fertility treatment down the line. She presented with dry skin. She said she felt like she was aging prematurely, as well as cold hands and feet and Raynaud's syndrome in her fingers. She had a history of heavy smoking, anorexia and bulimia, which she received treatment 3 years ago for. And her mood was very much affected by her weight and how her stomach felt, which was constantly bloating. Her diet was very high in caffeine, so she had 7 coffees a day, and she loved fruit. She said that was the hardest thing that she would find to give up, was fruit. She had 2 or 3 pieces of fruit with every meal and also with her snacks. Because of her history of anorexia and bulimia, she also had a very low fat consumption in her diet. We're eating fat-free dairy. She wouldn't have any oils on her salads, very small amounts of salmon, like a few, maybe 30 grams, and only white meat. And she'd eliminated bread, pasta, pizza, and because they were things that triggered her binges. So one of the things that I did for her was to make sure that she included more cooked foods into her diet, so soups and stews instead of salads or raw vegetables, and make sure that she increased her essential fatty acids to really help with that inflammatory response, as well as her hormonal and skin issues. So adding more flax seeds and chia seeds and oily fish into her diet. I tried to get her on a more FODMAP style diet by removing a lot of the fermented foods, especially the fruit that she was eating, and reducing her caffeine consumption by replacing either with decaffeinated Swiss water, decaffeinated coffee, or herbal teas that can help with digestion, like pu'er, which is a fermented tea, nettle, anise, and peppermint, or fennel. But some of the fennel and chamomile, I asked her to look to check her symptoms because some of them are quite high FODMAP. I asked her to reduce her fruit consumption and just mainly eat berries and really work on her stress management by doing meditation and yoga and sort of lowering her high impact in exercise. Keeping a food diary to identify any triggers, and also some castor oil packs 3 times a week to really help with digestion, as well as with her hormonal issues with the large clots. What I recommended in terms of supplements was magnesium, essential fatty acids, adding digestive enzymes, and the probiotics in the form of the Micromax. I also recommended a herbal bitter that she took, and she messaged me about a week later after starting this protocol, saying that all of her symptoms were actually, like the bloating and the gas that she'd been experiencing for years, had stopped. And after about 4 weeks, when we met again for a follow-up, she told me, and she hadn't really realized, but that she had been able to eat legumes, which she actually really loved, but was avoiding because every time she ate legumes, she would get really bloated and cramping. She said that she had had lentils the night before and hadn't experienced any symptoms whatsoever. She was still a bit worried about her weight and not being able to lose weight, but I think with a history of very low calorie diets and her history of eating disorders, that she might have created a metabolic imbalance. So this was something that we needed to work on more long term to try and get things into balance. But the fact that she experienced such relief in her IBS symptoms, which had been ongoing for many, many years, was really positive. So that's it from us. I'm really happy that you attended this webinar. If you have any questions, you're always welcome to email nutri@healthy.co.uk, and we're always happy to help. Or you could give us a call at the office on 0208 480 1000. And if you are a practitioner and do require a CPD certificate, then please email us in and we will send you an NNA accredited CPD certificate. This is the beginning of this is the start of a series of practitioner webinars. So if you'd like to sign up to find out more, you can go to our website, healthy.co.uk/practitioners, and you can sign up as a practitioner or just to be alerted about when the next webinar is. Thank you very much, and I hope you have a lovely day.